It's a very useful contrast media and it's very safe. It has a very high spatial resolution and it has also a temporal resolution and which is more, and it should give a good contrast study. It is used as an alternative for the above two or previous two contrast media, and this is always used whenever the lesion is not detected on a routine B-scale B mode imaging, and these lesions can be characterized with ultrasound. And there are three generations of the ultrasound contrast media. The first generation is the products which do not pass the pulmonary vascular bed, and they are therefore limited to any venous system and the right heart cavities. The second generation is the contrast media. Both are sufficiently small and stable. They are small and stable to pass the systemic circulation. And the third generation is they are more stable and echogenic, and they can pass the pulmonary vascular bed. And there are the various micro bubbles which have low toxicity in the human beings. And okay, this I'll skip. So Sonovi is one contrast which is readily available with us in the market today. And there are the various benefits of this contrast medium: real-time imaging, non-ionizing. It's easily portable, and it has a relatively low cost compared to the MR contrast media. And we can, it will remain in the vascular bed for longer time. It doesn't excrete through renal system, so that's why it's very safe. It is excrete through the expiration, and it has no nephrotoxic content within it. And uses in urinary system is vesicular reflex, imaging in the prostate and imaging in the kidney. For short of time, that's why I'm running through this. Useful in the VUR and to know the various stages, grade 1 to grade 5. It can be seen nicely. And this one here you can see grayscale imaging. We can see the reflex and urethral and the kidney nicely. But once you use the contrast, we can see both details of the grayscale imaging as well as contrast imaging. And we can subtract the grayscale imaging and we can get the contrast opacification. So it's very useful and very informative, and it can be used for diagnosing various pathologies in the kidneys as well as the renal transport kidneys and transport cases where we can see any thrombus or infarctions and vascular anomalies in stenosis we can see, and also to interpret the benign malignant lesions. So in prostate, yes, it is very useful when you want to take a biopsy to know the exact location of the lesion, which is an hypointense, and the normal intense pattern. This is a lesion where we can see nicely after injecting about 24 seconds of the contrast. So there are the various uses of the contrast media which are in use today, and they help us to study the urinary tract. Thank you very much.